necessarily obey any specific social or cultural or demographic boundaries, not always. But I also do think we need to be very cautious with the types of parallels that we draw between one virus and another. I do think in general, we're all accustomed to drawing parallels to COVID-19 these days just because of our familiarity with it. And in some instances, I have seen parallels between HIV and monkeypox in the media. But these are respectively very different viruses, HIV and monkeypox virus, if you will. HIV is a deadly disease if left untreated and without a really readily available cure. Um, but the converse of that is HIV is actually a chronic manageable condition, which some people may not know. And access to early treatment, if afforded to people, can render people the ability to live a long, healthy, happy life, provided they have the therapies and medicines to do so. Now, monkeypox, on the other hand, is a time-limited disease. So meaning that in most people who become infected, people develop an illness, but it does go away on its own. This form of monkeypox causing the current outbreak actually in most cases is not lethal, as I mentioned, unlike HIV. 99% of people do recover without hospitalization or treatment. But unlike HIV, there is no single FDA-approved treatment for monkeypox. There are drugs that are being used on an investigational and a very limited basis, I will say. And then as far as some of the broader parallels, that being said, that doesn't mean that we should minimize the importance of this monkeypox outbreak either. People experience a lot of physical pain and trauma, physical trauma and pain associated with the virus. And so just because there are not as many people affected by monkeypox as there were with COVID-19 or HIV, that doesn't mean we shouldn't take it seriously. And I will say lastly, what is similar is that there are still unknowns. This is a similarity between HIV earlier on, to your question, Ted, and monkeypox now. There are some unknowns about this virus with respect to why it has spread so rapidly to many parts of the world, whereas before it was confined to more discrete, specific areas. And I think the same questions circulate now with respect to how can I keep myself safe, and what are my options for treatment and prevention?
Thank you so much for that information. Dr. Zamora, I'd like to turn to you now and talk about the symptoms, which is a critical piece to responding and preventing the spread of the disease. So can you walk us through the primary symptoms of monkeypox? Dr. Zamora, we need you to turn your mic on.
Sorry about that. A key part of understanding monkeypox is education in response to symptoms. And certainly symptoms are fever, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, and like the previous physician said, a rash that looks like pimples or blisters that can appear on the face, inside your mouth, on other parts of your body, including your hands, feet, and genitals and anus. The rash goes through different stages, and you must remain isolated until all the scabs have healed.
And Dr. Zamora, I heard an interview, I think it was on the New York Times podcast, where talking to somebody who had had monkeypox and who first thought it was COVID. And so I'm just wondering if somebody, they don't know, they might think it's, because some of these symptoms are similar, not all, of course. Any advice as a doctor if they're just not sure?
Sure. Well, certainly look out, find your primary care physician, and they can tell you for sure. But the most distinguishing factor between BA4 and BA5 is BA4 and BA5 give you the severe sore throat, but no lesions. You're not going to get sores on your face or your hands or your feet or genital area.
Thank you, Dr. Zamora. Dr. Norwood, we want to talk about how monkeypox spreads. And I know we've touched on that already, but what is the most common way that it spreads person to person?
Yeah, so the way that monkeypox spreads is different from COVID-19 or other diseases. Unlike COVID-19, which we know spreads really easily, and that's why it kind of went through our community so fast, monkeypox only spreads when there's prolonged physical close contact with someone who has the infection. So it also only spreads when somebody has symptoms. So the symptoms that Dr. Zamora mentioned, like rash and fever, that's when somebody who has the infection can spread it to others. that's unlike COVID, where we know some people didn't have any symptoms but could still spread it. So that's a major distinguishing factor. And like I said, it really requires, what we're seeing is that it tends to be people who have had prolonged, meaning like a long time with very close physical, personal, or intimate contact with the person who has the virus. So
shaking hands or a hug.
Generally, we're not seeing that. What we're seeing mostly is after sexual contact, because of continued rubbing,
Right.
Skin to skin rubbing with somebody who might have lesions that they didn't know about or weren't apparent. So the examples that I can give are intimate physical contact, like prolonged kissing, cuddling, sex, definitely, because we're seeing a lot of the lesions tend to be on the genital area or the anal or around the butt area. So direct contact with those infectious rashes, including scabs, and then body fluids too. So we think it's in saliva and may potentially be in other body fluids as well. It is possible to spread monkeypox from the saliva in terms of respiratory droplets. So we wearing a mask for anybody who has the infection is strongly recommended. Again, we think it requires prolonged face-to-face contact without a mask with somebody who has the infection. So it's not quite as transient as we know that COVID has been, like where exposure could be, in a restaurant. We're not seeing that. And then touching items that have been exposed to a rash or bodily fluids. So things like bed linens, clothing that have rubbed on fluids or rash, then somebody touching those could potentially be exposed. And then finally, we know that pregnant people can spread the virus to their fetus.
So we've had questions about concerning spread, touching doorknobs, elevator buttons. Are those concerns?
Not really. We're still learning more about this virus. So I can't say that there's not 100% possibility, but over 99% of the cases that we're seeing have been from prolonged intimate contact. And that's why we're seeing the spread mostly in terms of sexual contact, is because it really requires that prolonged skin to skin contact. So no, just by, touching or briefly talking to somebody, that's not what we're seeing as the exposures.
Dr. Stefanowicz, let's talk about just decreasing risk for exposure. What would be the most effective ways, the key tips that you would offer or recommend?
Sure. I mean, there are multiple tools at our disposal to prevent the spread of monkeypox. Firstly, and this seems like a no-brainer, but just knowing that monkeypox is circulating here in this community locally, and anyone here can get it, that's an important first step. And I will say anecdotally, many patients of mine who I've seen here for monkeypox in our clinic, and some of whom we've treated, said firsthand, Dr. Mike, I didn't even know this was a thing or a problem in our community here. And so I think while it sounds kind of obvious, being good stewards of information and letting our fellow citizens who are perhaps not as tuned into the daily news cycles is a responsibility that we all share. On social media, sharing trusted sources of info from the CDC, World Health Organization, and Austin Public Health, I think is a great way to inform our friends and family.
That's really key, I think, on social media, is to trusted sources, not your neighbor, not your aunt, but trusted sources like you just mentioned.
Yes. I think, and that's something that we as individual citizens, you don't have to be a public health or a medical doctor to convey accurate public health information to other people, especially given how quickly news travels or information travels via social media now. But I will say, as far as other tangible things I would recommend to the audience, I think it's important to know that you can reduce your risk by limiting skin-to-skin contact with partners. If you have more than one partner, I think it's prudent to consider limiting your intimate partners to a smaller network of people that you know, perhaps partners with whom you're more familiar at this time. Certainly, it's important to be mindful of intimate contact, including kissing or touching with partners who have new rashes or spots on the skin or areas of concern, or any other symptoms like fevers or chills or sore throat. I think in general, having worked at a sexual health clinic, I think it's important to normalize conversations about sexual health with your patients and their partners. talk with their partners about recent exposures or concern. Also talk with partners about other forms of intimate contact that can reduce your risk of monkeypox. And then lastly, and I think Dr. Zamora had touched on this already, I can't echo it enough. I think it's important to take care of yourself. And if you're among the groups of people most affected by monkeypox right now, then consider checking in with your primary care doctor as well. If you don't have one, consider establishing a relationship with one, with your medical provider. And then I think routine skin checks and checking in on your overall health is another good place to start. And then lastly, because I know it's on everyone's mind, and my colleague, Dr. Desmar Walks, who's been phenomenal, will speak more about how vaccines are one emerging piece of that national strategy as well.
Yeah, and we're going to show some information here in a minute about where people can go for trusted information. And for the record, I didn't say that your neighbor and your aunt aren't trustworthy. I was just saying we have better sources perhaps than your neighbor and your aunt for information. We do have some questions via Facebook Live, and I want to turn to my colleague, Yvonne Davila. Yvonne, do you have a couple of questions?
I do. Thank you, Ted. So Maria Cunha is saying, what are we doing to prevent any stigma or treatments relating to the same LGBTQIA+ community? Austin is a safe and accepting home to live in. I want to keep it that way. Dr. Stefanowicz already spoke to this, but maybe we can expand on it.
We could open this up to anybody who wants to take that question. Dr. Walks, would you like to take us?
Sure. At the outset, we have been very clear about the fact that we are committed to health equity, and we're committed to making sure that our community knows that we are here to help them through those disease entities that impact our community. So having said that, the message has been that this is a disease that has been around for a while, and we've been able to successfully keep it at bay for many, many years. And in this instance, we have a different part of our community that's been impacted, and we're careful to let people know that anybody in the community, regardless of whether they are from the community that's being impacted now or from the general population elsewhere, they are all subject to or can possibly get or be exposed to monkeypox. So we're messaging that. We're very clear that that's the case. And we're very clear when we're talking internally that we're going to do all that we can to prevent any stigmata from happening as we go forward.
Thank you. I want to invite our guests in the room. If you have questions, we're happy to take your questions as well. But I believe Yvonne also has another question.
Yes, Sam Saxena is asking, I have heard some people say we should not be calling it monkeypox, but rather MPX or MPV. Can someone speak to this?
And I know this was a debate that's been going on maybe a month or two ago. It was a big conversation, but does anyone want to address that? And is there a stigma attached to the name itself?
At this point, we've heard conversation about it.
Right.
There hasn't been a change
Right.
that's been made at the CDC level. Our biggest concern right now is getting the message out to the community about how they can protect themselves, and particularly how we can help the community that's being affected right now, because this, as Dr. Stefanowicz has said, can cause pretty painful lesions.
Right.
And we focused our energies on reaching out to that community.
So yesterday, President Biden's health secretary declared monkeypox a national health emergency. The World Health Organization called it a global health emergency last week. And I'm just wondering, what does that mean to the response in terms of freeing up funds, making vaccines more readily available? And I'll open this up to anybody who would like to answer it. But Dr. Walks, maybe on the county level here for Travis County, what does that mean for us and our response?
At this point, we have yet to receive any additional funding to address our response. And Director Stirrup is in the audience, and I'd love to give her the opportunity to speak to this further.
Do you mind?
Thank you, Dr. Walks. I think it means for us that we are eagerly anticipating additional resources to expand the operations here at Austin Public Health. Not only does the declaration bring the promise of additional funds, but it also creates a pathway for us to move quickly outside of normal procurement processes if we need to set up larger vaccine operations, if we need to onboard additional staff resources. So it just elevates what we've known and seen on the ground for a couple of months now. So it's an opportunity for us to leverage those additional resources and the amplification of the need.
Thank you so much. Let's talk about vaccines. This has been a hot topic nationally. There's been a lot of concern and frankly criticism regarding the amount of vaccine that is available. So Dr. Wachs, can you give us the lay of the land for vaccines here in Travis County?
So when we started to see cases develop in our country, we realized that the reserve of vaccine, the Jynneos vaccine that we're now using, is limited in the strategic national stockpile. So we have that as our starting point. And Austin Public Health at the very beginning requested vaccine, and we received a small amount, 150 doses. And then we subsequently started vaccinating people who were high-risk individuals who had high-risk exposure, and we're required to follow the guidance and the rules that are set around the use of that vaccine. So that's continues to be what we do. We then subsequently ordered another 5,000 vaccines, and we received 3,000 doses. And as you know or may know, this vaccine requires that you get 2 doses. So you get 1 dose, and then 28 days later, you get another dose. And so that amounts to 1,500 courses for 1,500 people. We continue to request more vaccine, and we continue to use that vaccine as we're guided to. So that vaccine is for people who have had direct skin-to-skin, high-risk exposure to someone who is known to have monkeypox. They have a positive test result that we have on file. And then the other category, priority 2 for that use of vaccine, is somebody who has had multiple sex partners in the last 14 days in a jurisdiction with known monkeypox. So we are limited with the number of vaccines that we have in our supply, and we're in that mode of disease containment or trying to keep the monkeypox from spreading in our community. So we're targeting our scarce resource where we feel that we're going to have the most bang for the buck, if you will.
And so just again to repeat, the vaccine is not available and not for everyone at this time, correct? And the vaccine is not a silver bullet, if you will. It's not immediate protection or cure the minute you get the vaccine, correct?
Correct. You have full protection from the vaccine after getting the second dose of the vaccine at 14 days after that second dose. So it's still important to do those non-pharmaceutical, non-medical medicine things that we talk about, washing hands, making sure that you don't have prolonged direct contact to skin that has rashes. And if you're going to have direct, long, prolonged contact with somebody who is sick, wear a mask so that you don't have exposure to virus that may be in respiratory secretions.
Dr. Zamora mentioned earlier that if you are experiencing symptoms or believe you may have been in contact, we can put the slide up on the screen. You should call your healthcare provider. If you don't have a primary care healthcare provider, you can call Austin Public Health's Equity Line, and that number is 512-972-5560, and we'll share that information again later in this presentation. Let's talk about testing. Dr. Wachs, what's the recommendation regarding getting tested?
So anyone who's experiencing symptoms of monkeypox, as we've talked about, as soon as you start to have those symptoms of fever, chills, headache, feeling really tired, having a lot of pain, contact your provider. Those symptoms can be symptoms of something else. So they will have the wherewithal to work with you to see if you're sick and if there's something that might be happening that's related to monkeypox or something else. We actually can only test the rash itself. So when the rash comes out is when that provider will swab with a cotton Q-tip those areas on your skin where the rash is, send those off to be evaluated and tested in the lab, and then make a determination as to whether or not you need medication for this. As you've heard, this is a self-limiting, or it's a disease that can just resolve over time by itself without medical treatment, without medicine. And in most people, that's what it does. And you're recovered when the scabs fall off and you have a fresh layer of skin. However, there may be some people who need severe, or people who've had organ transplants. People that are less than 8 years old, and women who are pregnant or breastfeeding. So if you happen to fall into any one of those categories, then your clinician may be wanting to contact us and arrange for treatment. The other category that's most important to remember is that there's some people who get this in their mouths, in their on their genitalia, and on their rectal area, around the anus, the butt area. And in those areas can be very painful and cause really debilitating pain. And in fact, there are few people that have had to go to the hospital for this, but those instances where people have had to be in the hospital for, say, 24 hours, it's been because they've had pain. So it's important to get in touch with your healthcare provider. And if you don't have one, call APH, and our health equity line nurses will help arrange for you to be seen by a provider.
Dr. Zamora, you're in the field seeing patients every day. What should someone do if they test positive, and what has been your recommendation for your patients?
Mic's off. My mic's off. So for the most part, like Dr. Walk said, and Dr. Mike has said, it's self-limiting. 3 to 4 weeks, it goes away on its own. Most people just have sores and they go away. But if they have severe pain, they should find somebody to take care of them, a primary care physician or the emergency room. There are some treatment choices we do have, but we're as Dr. Walks has said, we're limited on our resources right now. In the future, we should have more resources. But for the most part, most people it's self-limiting, and it's going to go away on its own, and you'll have a nice fresh layer of skin.
Dr. Norwood, I wanted to ask you, in your role at Vivint, it's Vivint, correct? Mm-hmm. What are you hearing from patients and clients at Vivint? I wonder what the level of anxiety is currently, fear, and how is that impacting people actually seeking care and getting care?
Yeah, I think there's a lot of fear, and I think that's why roundtables like this are really, really helpful, because we want to make sure that people have the opportunity to ask questions and get good information. So, this is, we all have trauma from COVID, and of course, trauma from other diseases like HIV, which was mentioned. And so there's a lot of fear around this pandemic and this disease. So we're having clients and patients come and who are scared and asking, am I going to get this? How can I protect myself? So the things that we covered earlier, I think are really helpful to understand. And I think they actually do help with the other question that came from the audience about stigma. Mm-hmm. My suggestion for both getting the information out and for reducing stigma is just focusing on the basic facts of what these symptoms
Right.
are and how it's spread. And so we know that the vast majority of cases are spread through prolonged skin-to-skin contact. And, you know, if you are able to talk with sexual partners who you may not know about whether you've got any new rashes, any new lesions, if that's part of, another conversation, kind of like we've had to do with dating with
Right.
COVID. Do
Yep.
you have a new cough? Have you been tested recently? I think this is just going to be another conversation. Hey, I'm trying to keep myself safe. Have you been sick lately? Have you had any new rashes? That's something that we all may want to, especially right now, while we know it's spreading, just incorporate into our practice, and that's for everybody. So recognizing that anybody who is, having sexual or otherwise intimate or just close personal contact with somebody who they don't know, they might want to ask those questions. I think also.
Do you get the feeling that people who aren't at high risk currently are just saying, not my concern, I don't have to worry about it?
No, I think that this information is not getting out as broadly as, and two, that they know, what the right questions are to ask. I also think that, we made a big mistake as a whole community or population back when we were first discovering HIV and thinking and having these myths about who it's spread in and who it could infect. And that, so just recognizing, again, we need to be really broad with our messaging about, these are the symptoms, this is how you get it. Everybody should be aware of this. Everybody should take precautions. A pre-existing condition might have worse disease, and so they are also considered a higher priority group for treatment.
And this question might be for Dr. Walks or Director Stirrup, but there's a question about, are there any plans to have a centralized testing site as we did for COVID? Who should I? Director Stirrup?
Because of the areas that need to be swabbed, it's a little more nuanced and not as easy as, setting up a station to swab your nose. It's quite a different thing. And so we have had conversations with partners that are willing to bring resources to bear. So as the situations develop, as more private labs come online, as our healthcare partners build their capacity, we're really trying to have a system-wide approach to figure out what will be best for Austin and Travis County. But right now, everything's on the table.
And this is an evolving national global public health emergency. We have a question from somebody via Facebook. Can you repeatedly get monkeypox? So can you get it twice or 3 times like we now know we can with COVID?
I can speak to this.
Right.
So the short answer right now is no. You are not at risk of contracting monkeypox again. In fact, you are thought to have a natural immunity conveyed by the monkeypox infection that would prevent you from becoming infected shortly thereafter. I think this is going to be a common question in the community, especially as people, to your point, Ted, see reinfections with COVID-19 in subsequent months. And so right now, based on the current facts and based on what we know from smaller outbreaks previously, and like I said, monkeypox has been around, has been a known entity for about 50 years. It exists in different forms and fashions. But based on the current facts that we have right now, if you were previously infected in recent months, you're not at risk of a recurrent infection right now.
Thank you for that. We want to talk, we put this together relatively recently, but the things that monkeypox is not, the myths, and this is a starting list, and I'm sure that the experts in the room, and I'm not one of them, can add to the list, but monkeypox is not a sexually transmitted infection. It's not a new virus. It's not yet a pandemic. It's not untreatable. It is not always easy to recognize, and it's not limited, and this is a really important one, to a specific gender, race, country, community, or I would add a sexual preference. So any others that we didn't miss, any of the myths that we need to bust that we're hearing out in the community, anybody in the audience have anything to add? Any of our doctors, do we cover most of the things that monkeypox is not?
It's not chickenpox.
It's not chickenpox. It's not fatal.
Yeah, it's not.
That
In most cases,
I should say.
Yeah.
Anything else that we?
I question the pandemic part.
Yeah.
They haven't called it that yet, but it is all over the world and impacting communities and countries all over the world.
So we should put a
Possible
question mark by that one.
Yeah.
I do want to see if anybody else has any questions. Brandon Ollerson with Del Medical.
Yeah, I'm curious, learning that the, I guess, isolation period is 2 to 4 weeks, knowing that communities already struggle with that within the COVID situation. What strategies do you have for folks to navigate that specific window? And then what strategies are we willing to explore around ensuring that folks are aware of mental health resources and all that to really navigate that specific window of time?
That I will attempt to, but please help me with this one. That's a really good question. So you're right that it generally takes 2 to 4 weeks for you to be not infectious if you have this disease, and that's because it takes that long for the scabs to form on the lesions and then to fall off on their own and for new skin to grow underneath, and that's when you're no longer infectious, and so that can take 2 to 4 weeks. During that time, in order to not transmit to other people, we're telling people to isolate, meaning wear a mask. Again, this is different isolation than COVID potentially, because COVID is so much more easily spread. And so that isolation means wearing a mask to protect others from your respiratory droplets. But if you're not having that rubbing skin to skin contact, you're not otherwise going to transmit that disease. So depending on somebody's personal circumstances, that might look different. I think now that President Biden has declared a public health emergency, ideally we want to advocate also for sick pay for people to have the ability to stay home from work if they can't avoid those kinds of contacts and to fully isolate. That would be the ideal, and I think that's something we need to advocate for. I'll leave it to others and so we ask your doctor for notes. We're happy to respond to help with the money that will be needed for that.
We have taken care of a significant number of people here diagnosed in Travis County with monkeypox here at our clinic, and so these are day-to-day challenges that people infected with monkeypox are facing. How am I going to pay the rent this month? How am I going to keep my job with such a prolonged isolation period? In the clinical space, we are doing frequent check-ins via phone with many of these patients to check in to see how they're feeling, both physically but also mentally. And I would say in the clinical space, if you or are part of a healthcare setting that has resources for mental health or therapeutic supports, I would say it's very important to leverage those and very important to offer those to people because patients have told me that this is a condition that has been very isolating. Even if they live with other people, the guidance is really to isolate at home in a separate space, ideally use a separate bathroom, separate kitchen space, and we all know how implausible that can be for many people in a close, tight space. Even pets, There is specific CDC guidance with respect to if you have pets at your home, to please isolate from your pets if somebody else can take care of them, because there is a potential for animals to be reservoirs. And so I think some of this is evolving, but it's definitely a very big felt need in the community right now. But I will say, messaging wise, in terms of a time frame, that is the average time frame for isolation. But really, what we tell patients on a day-to-day basis is, just has been iterated 3 times already, the scabs have to fall off and new healthy skin is growing underneath. And I will say that's different for different people. Some people have healed fairly quickly, closer to the 2-week time frame, but some people it's been a lot more protracted, close to a month, and that's a challenge.
I'm so glad you mentioned the emotional side, because that is very similar to COVID, where we saw an increase in behavioral health challenges and people needing support. And so the isolation piece can be devastating for somebody who's already feeling the physical pain. So I'm glad that you brought that up. We have more questions here in the audience. If you don't mind just saying your name and asking your question.
Sure. My name is Vivek. Dr. Zamora mentioned earlier that these symptoms eventually do go away on their own. Previous speakers have said that, a vaccine takes some time to kick in, but y'all have also mentioned that it's effective. And there's a question of whether or not this will be considered a pandemic at some point, as it's kind of raging around. So my question is, are there any conversations currently about if and when vaccines become more readily available, what that rollout might look like in Austin specifically? Thanks.
Definitely. We are meeting every day, discussing the situation, updating our policies and procedures, and logistically considering what we do with our current supply. And we have plans in place for when we do have enough vaccine to roll that out and stand up distribution of that vaccine as we have in the past with COVID.
And some lessons learned, I would assume, from
Definitely
COVID.
lessons learned. At this juncture, we're working with our partners in the community who know the patients that are most at risk. And as I said earlier, we're really reaching out to those individuals to get them the protection with the limited supply that we have.
And I know the Austin Public Health team is employing the go where they go strategy and really reaching into the community to try to get information out there.
Right. And I also want to go back to the previous conversation about isolation. And I want people to know that aren't going to see providers, that may need assistance with mental health issues and resource issues, that they can call that 512-972-5560 number. And there they can be given some information about resources that would be available to them for all of those things that we've talked about that may be an issue. And also to really put a pin on the isolation piece about it being a person that has this, where possible, being in a room by themselves, hopefully using this bathroom that they alone use. And if they don't, then having the cleaning of that space so that others can use it without being exposed to virus. And just please stay home if you're sick so we can contain this thing.
Dr. Stefano, what's really got my attention when he talked about the pets. So I hadn't heard that one. So that's another piece of information that people need to know about when it comes to isolating and making isolation difficult. We do have another question via Facebook Live. Is there economic support for individuals who will need to isolate? And I know we were talking about even time off from work. That's not possible for everybody. People work hourly jobs and don't get paid when they don't show up. They don't earn a living. So is Austin, Travis County, or any other organizations that you know of working to address that, the economic side? Director Stirrup, I need to pull a chair up here for you because I keep coming back to you.
That is a very good question. And I think that's one of the other potential benefits of the president declaring a public health emergency. We were able to do a lot of that with COVID through CARES Act funding. So if that comes through, I surely do not. If that comes through, that's something that we would definitely make recommendations to our elected bodies For right now, I think the best space is for advocacy, for us to continue to work with our partners throughout the private sector with the different chambers to provide information and let them know that, aside from the personal health implications, there are some other factors that the community will feel: time off from work, decrease in services, all the things we saw with COVID. So lessons learned, right? Let's remember and do better for our employees the next time. So right now it'll have to be on an individual level, but definitely if those resources come through, it's something to be considered.
Thank you so much. We have a question from the audience. Ren
Gonzalez from Out Youth. We serve youth 5 to 25 currently, at least in my department. We're hearing lots of questions from parents who are concerned about their kids going back to school and are confused by this mixed messaging of people are getting it through prolonged, usually sexual contact, but that's not the only way you can get it. And my kid likes to roughhouse, and it's summer in Texas, and everyone's sweaty, or we're going to the pool, or. What should we be telling our parents about how to protect their kids, especially as they're about to go back to school? Some of them in that 5 to 7 age range, as well as those. I had one mom call me yesterday whose son is going to be joining the wrestling team for the first time and is super excited. And now she's like, should I let him wrestle or play football or any of these other things that our kids are very much looking forward to that they didn't get to do because of a pandemic? What do we tell them?
I think that that's an excellent question. And
of course, it's from Out Youth. It's a great question.
yeah. Anytime we're dealing with a communicable or a disease that can spread in our community, it's going to be important that we do the screening that we've done in the past to help identify people who might be sick and have them stay out of the play or the situation that's ongoing so that we can protect those that are not sick. So we're going to have to be diligent about that and allow our children to be children and have those people that we identify as being sick in a situation where we can identify what their illness is and let them recover without spreading it to other kids. And that's hard with children, as you rightly pointed out.
We have a question via Facebook. Just went away.
I was just going to add one
Oh,
more
go ahead,
thing
please
to
do.
what
Please
Dr.
do.
Walk said. I completely agree. And I think that the screening is really, really important. And knowing that monkeypox can have things like fever first. Sometimes the rash just comes, but sometimes fever can precede the rash. So just being super diligent amongst these play dates or amongst the, all of the kids that are getting back to school, just kind of like we were doing with COVID, being, diligent about monitoring. It's a little bit easier than COVID again, because it spreads when somebody has symptoms. So if the kid's sick, if there's a rash, fever, headache, that kind of thing, staying home and waiting to see, what happens, being really diligent about checking in with the doctor and isolating, I think that's going to protect kids from being exposed.
Thank you. We have a question via Facebook. Are there isolation kits available with instructions or best practices for people who cannot reasonably isolate themselves at home? Is there something that people can pick up or a place to go to get the really specific instructions about how to do that?
So we have information on the APH website about how you can safely isolate at home, and so you can go to our website, and then of course you can also consult the CDC website, and there on both of those sites you'll be given some guidance on the best way to handle being in the home, communing with your relatives and friends that may be living with you. And also it'll give you some tips on how to handle laundry, what kinds of cleaning products you can use to clean surfaces. And so I would recommend going to that website. Quick piece though about laundry. If you are caring for somebody who has monkeypox, you should wear a mask and gloves. If you're going to take care of their laundry, if they're unable to do it themselves, which is the ideal way to handle laundry, make sure you're not hugging it, and make sure you're wearing those gloves and a mask. And you can it's better to put the laundry into a cloth laundry bag, and then you can put all of that into just a washing machine with regular detergent and wash it, and it's fine after it comes out, and dry it and so on. But there's some tips like that you can use so that you can take care of a loved one who may be sick and protect yourselves from getting it.
I have a question about vaccines. This person is asking, has the White House given any indication on when the next allotment of vaccines will be distributed? And do you know how frequently they'll be moving? Which I think I could answer that question. But also, I think this is really important so we can move from post-exposure to more of a pre-exposure prevention approach. Any ideas on that? I'm looking for any of our expert panelists that want to take that one.
There's supposed to be 3 phases. We're in phase 1 right now, and there are 3 waves of each phase. We're in the first wave of allocation, and we're waiting for that vaccine that is actually manufactured in Denmark to be available, and it's anticipated that we should be able to get more vaccine here in the United States in sometime in the September timeframe, at which point they'll reassess and make allocations appropriately.
Thank you so much. We are nearing the end of the conversation. I want to remind people that if you have a doctor or a healthcare provider, you should please call that provider. If you think you've been exposed, you're experiencing symptoms. If you don't have a doctor, please call Austin Public Health's Equity line at 512-972-5560. We put on the screen a couple of websites, Austin Public Health's website regarding monkeypox, the CDC. There are others out there. We just urge you to use a trusted source to get that information. And as we wrap up, I want to give all of our panelists the opportunity, no pressure, to share some final thoughts if there's something we didn't cover. And also remind our viewers that we are going to we have captured these questions. We will answer the questions, and we will post them on Facebook, Austin Public Health's Facebook, Central Health's Facebook, and make them as widely available as possible. We hope that the people in the audience, our guests here today, and everybody watching will help us share facts, information, not misinformation. But final thoughts, and I'm just going to open this up to anybody who would like to speak.
I can start. So I think it's really important to have relationships with trusted healthcare information sources, have a relationship with your doctor. We are happy to take questions by Vivint Health. I know community care has been super active in this space too, but just making sure that people have the knowledge that can empower them to make the right decisions for themselves. And I kept coming back to your question. So for example, knowing that while it's really important to have all of the information about how monkeypox can spread, and that it of course can infect anybody because it's a virus and it doesn't care, that for example, there's only 2 kids in the entire United States who have confirmed cases, and none in Texas. So just kind of knowing, we want to be vigilant, but we don't want to scare people and make them think that every interaction is going to be dangerous. So the more information we have about where it's currently spreading, getting up to date on the CDC website, and talking with Austin Public Health about what our numbers are, so you can gauge risk, and then knowing how you can protect yourself, asking those questions, asking maybe even school districts, they're in contact to know if it's starting to spread, say, in other communities.
Great advice. Thank you so much. I'll look to our remote experts, Dr. Zamora. Dr.
Thank you for this time. I agree with my colleagues. We need to reach out to our partners. It's at community care for our primary care physicians. More importantly, integral care. Who right now we're under a lot of stress, and if you don't mind posting their number as well, Ted, for those that are having psychosocial issues.
All right.
Thank you, Dr. Zamora.
I want to just echo the sentiments of Dr. Zamora and Dr. Norwood as well. Thank you so much for having us again. I think having more platforms like this, where we've done plenty of discussions and Q&As with medical providers, But I think for an equity-based framework to really evolve, we need to have more dialogue like this, both on a virtual space, but also in person with community members to get their feedback, to get their questions, to get their concerns. I think that's something that we have all learned since COVID-19 is that needs to be an ongoing dialogue, that we don't always have all of the information at hand right here and right now. And in some instances, to some of the earlier points with regards to testing or the limited availability of vaccinations, right now resources are finite. And so one resource that we do have is we have an open, honest dialogue with our community members. We're able to convey accurate, relevant information in as real time as possible. And we want to empower other members of the community to really forward that information along to others. Lastly, I will say, and we've learned this over the last few years, is that, and this is to allay fear, there are various tiers of risk. There's very little that is considered in life that we do, whether with COVID-19 or with monkeypox, that's considered no risk. Low risk is not considered no risk, but there are various tiers of risk. And I think a lot of our conversations around monkeypox are very nuanced. And so we know that it's intimate skin-to-skin contact for protracted periods of time conveys the highest risk. And with that, there's a whole spectrum of different opportunities for people to protect themselves that we've already talked about, and I won't belabor there. But I just want to thank you once again for giving us the opportunity and the platform to have this dialogue.
Thank you, Doctor. Dr. Walks, may I tee up your closing remark? Because we got one more question. You already covered it, and I'll come to Director Sturp as well. But we got one more question. You covered it before, but I think it's worth repeating. Who can get the vaccine now? And we can put that slide back on the screen as well.
So people who have been exposed to a known case or person who has monkeypox, close, intimate exposure in the last 14 days is priority 1. Priority 2 would be a person who has had multiple sexual partners in the past 14 days in this area in Travis County where we've had multiple cases of monkeypox. So those are the 2 priorities that we're working within right now. And I just want to echo what Dr. Stefanovic has said, and that is that we are here at Austin Public Health to provide you the information that we have as we know it. We're going to tell you when we don't know, and we're going to tell you when we do know. And we are here to help protect the community's health and to prevent the spread of disease. And so we're committed to that, and we're committed to this community. And we want to thank you for arranging this for us so that we can speak to our community and empower them to be ambassadors of the truth as we know it about monkeypox.
Thank you so much. Director Sturp, do you mind passing the mic? Thank you.
Yeah, just to echo what Dr. Mike and Dr. Walsh just said, I am always amazed at what we were able to accomplish as a community with respect to COVID. Like, we stood up, and when other jurisdictions were struggling, we were able to contain it here in Travis County. So let's take that same power, right? Let's have the conversations. God knows I'm not a doctor, but as I learned from my colleagues, everyone that I could call, and in real plain terms, look at it, check it out, make sure ask all the questions, because this is not a game. Like, have those direct conversations within your circle so people can understand. This is something that we don't have to be reactive to, right? We have the upper hand. We can make choices. We can spread good information. We've done it before, and we can do it again. And so, that is my rally cry to the community. Be that information point in your community. And then, advocacy. We know there's some gaps with the approaches to health equity. We know as things are being delivered to us, we're responding in a framework that we know doesn't speak to the health equity piece. And that's where the community voices will be strongest, because we know what we need as a community and we know where those gaps are. So if we come together and we amplify those needs, we can change the game and not have a repeat of COVID. And so I thank you all for taking the time today. This is going to be posted on the various websites. Share the link with your friends and your family members so they can get the information for themselves. and let's get through this thing. I appreciate y'all.
Thank you to all of our panelists. Thank you for our guests in the room. On behalf of Central Health, the Travis County Hospital District, and Austin Public Health, we appreciate everybody who tuned in to watch, because it shows that you're interested in getting informed, staying safe, and helping us stop the spread. So we appreciate your time today. Thanks for being with us.
Thank you, everyone.
Thank you. Good to be with y'all.